rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hi everyone. Today I saw a patient who had recently undergone radical nephrectomy for clear cell renal cell carcinoma. He asked, "Doctor, what does my pathology result mean for my prognosis?" Rather than looking at the tumor stage alone, let's take a closer look. Our patient is a 64-year-old man with sporadic unilateral clear cell renal cell carcinoma. He underwent radical nephrectomy. Final pathology showed PT3 disease with no regional lymph node involvement and no distant metastasis. The tumor measured 6 centimeters in maximum diameter. It was nuclear grade 3 and coagulative tumor necrosis was present. Let's assess this case using the Mayo SSIGN Score calculator in the OncoToolkit. Necrosis, to provide historical prognostic information after radical nephrectomy for clear cell renal cell carcinoma. Let's enter our patient's information. First, we'll select the 1997 Pathologic T Stage. This patient has PT3 disease, so we'll select PT3A to PT3C. Next is the Pathologic Nodal Status. There is no regional lymph node involvement, so we'll select PNX or PN0. Now we'll enter the Pathologic Metastasis Status. There is no distant metastasis, so we'll select PM0. Next is the maximum tumor size. The tumor measured 6 centimeters, so we'll enter 6. Now we'll select the nuclear grade. The tumor was grade 3, so we'll select grade 3. Finally, we'll indicate whether coagulative tumor necrosis is present. Necrosis was identified on pathology, so we'll select present. Now click Calculate Score. Here are the results. The patient's original Mayo SSIGN score is 7 out of 15. In the original radical nephrectomy cohort, a score of 7 was associated with a historical 5-year cancer-specific survival of 41%. This figure represents an observation from the historical study cohort. It should not be interpreted as an individualized survival prediction or treatment recommendation. To see how the result was calculated, expand how this result was calculated. The 1997 PT3 category contributes 2 points. The Nodal status contributes 0 points. The PM0 status contributes 0 points. A tumor measuring 6 centimeters contributes 2 points. Grade 3 contributes 1 point. And coagulative tumor necrosis contributes 2 points. Together, these values produce a final SSIGN score of 7. You can click Copy Result to copy the assessment. To save it, enter the patient's name and click Save. Previously saved assessments can be viewed from the Saved Results panel on the right-hand side. The Clinical Workflow section also provides guidance on when to use the calculator and how to interpret the result. The original SSIGN model applies to adults with sporadic unilateral clear cell renal cell carcinoma following radical nephrectomy. The result should always be considered alongside contemporary staging, imaging, patient health, current guidelines, and multidisciplinary assessment. If you'd like to learn more, scroll down to the reference data below. Here you can compare each SSIGN score with its corresponding historical 5-year cancer-specific survival. For this patient, the final Mayo SSIGN score is 7, corresponding to a historical 5-year cancer-specific survival of 41%. The SSIGN score provides structured historical prognostic context, but it does not independently determine treatment or surveillance. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.